The sky is truly the limit, and I know it's going to be hard to get into these specialties. It can be hard to get. Hi you guys, and welcome back to Janine's Journey. And as you can tell by today's title, we're going to talk about the different types of nursing specialties that you can go in. You have completed nursing school, passed your NCLEX, and gotten your state license. Now, what's next? What type of nursing do you want to do? There is a wide array of nursing that you can go into, and I am just going to give you a list. I'm going to give you a list of just some of the few different types of nursing that you can go into. You've completed nursing school, you've passed your NCLEX, you got your license in whatever state that you're going to practice in. So after you become a registered nurse, you can pretty much practice in any practice setting. The hard part is getting into it, you know, getting into pediatrics, getting into L&D. Those are two different type of specialties, and there are certifications that you can get once you've practiced and had enough hours in that nursing specialty to just further your certification and your knowledge of that specific type of nursing that you decided to do. So let's just get into this long list of different types of nursing that you can do, some of which I've done, some of which maybe you'll do. So obviously, the first thing you can do is specialize and become a pediatric nurse. I mean, obviously I'm going to start in pediatrics because that's my heart, that's my boo. I love pedi. Make sure you check out my day in the life of a pediatric nurse. And next specialty is neonatal ICU nursing. And make sure you check out a day in the life of a float nurse, where I float to the NICU. But I am also formally trained in being a neonatal and intensive care unit nurse. So I was a NICU nurse as well, and it's hard. Being a NICU nurse is hard because you deal with the little babies who come out early, or babies who come out sicker and who need, you know, additional support and assistance when they come out of the womb. Become an ambulatory care nurse, which is basically just working in the urgent care as a nurse, and I work in urgent care as a nurse practitioner. Full circle, right? You can do bariatric nursing, and that's the specialty that involves helping those who suffer from obesity. Camp nursing. I was a camp nurse out in California, a summer camp nurse. When I was a travel nurse for an entire summer, it was the best experience ever. I'll try to include some pictures if I can find some here, but it was really a truly just life-changing experience. You can be a cardiac care nurse. You can work in case management. Case management nurses, they deal with patients who have chronic care needs, who need long-term care needs. So in the inpatient setting, sometimes I work with case management because they're setting up things outpatient for the patient. So their physical therapy, occupational therapy, making sure they have assistive devices at home in order to maintain a quality of life where they are able to perform their ADLs, which is their activity of daily living. So those nurses are, oh God, case management nurses, they're some unsung heroes in the nursing field as well. You could become a community health nurse, and you can work in a public health setting, and where you're setting protocols on how things are done, similar to what's happening right now in the pandemic. You can work out there and help track, you know, different COVID cases and things like that. Correctional nursing. I know a friend from high school who worked in the correctional nursing, and basically you are giving care to inmates inside of a prison facility. Dermatology nursing. I mean, some of these go without an explanation, so I'm just going to run down the list of the different type of specialties. Diabetes nursing, diabetic educator, diabetic teaching. That is something that I was interested in. Especially dealing with pediatrics, we get lots of patients in the inpatient setting who come in with what we call DKA, diabetic ketoacidosis, not realizing that they have juvenile diabetes, and so they end up there because their sugars are astronomically high, and you know, that's when they find out. And there's a lot of teaching that goes along with that, because Obviously, we have to help the parents and the patients cope with this new lifestyle change that they're going to have to deal with for, you know, a lifetime. Domestic violence nursing. This is more, some of these nursing specialties are more prevalent in certain cities and certain areas of the country, in your state, possibly or probably. I worked with a nurse who was a domestic violence nurse, and who would work in the ED. They work in the ED and they're called if, you know, someone unfortunately was raped and they needed to do a kit and do procedures, do an assessment and testing for that patient. ER nursing, that goes without saying. Emergency room nursing. So these nurses provide essential medical care to those who have to be flighted in from a small rural area to a more urban area or a bigger city that has the adequate supplies to better care for this patient. And they care for this patient en route to the bigger hospital. GI nursing, gastroenterology nursing, genetics nursing, geriatric nursing. And of course, that's the type of nursing that works with the elderly population. Some work in long-term care facilities. Some of them work in home health care. Nursing is its own separate nursing. But you can see a wide array of patients at home health care nurses, but a lot of the times they are geriatric or elderly patients. And pediatric patients a lot of the times as well. OBGYN nurse and obstetrics and gynecology nurse. Labor and delivery nurse. Health informatics nursing. Health informatics nursing is a specialty where they translate basically what we do in nursing practice into like our charting systems and things like that. So they help engineer the what do I want to call it, electronic charting systems that we use. Our, what do they call the software that we use to chart in the, oh, I can't even think right now. But health informatics nurse, they're the nurses that you call if you're having problems with your charting system, and they just come. You could be a hematology oncology nurse. I floated to hemonc when I worked in Atlanta as a travel nurse, and that is, oh gosh, that is a really, that takes a special type of nurse to work in hemonc, because not everyone there is battling a life-threatening illness, but it can be very taxing on the heart and the mind, and especially the body for those, I was gonna say kids because of course I'm a pediatric nurse, but for those patients. So that also takes a special type of nurse. And also, once you've worked in hematology and oncology for a while, you can get a certification. You know, you actually have to get certified because there's special medications that they pass in hemonc when you work as a hemonc nurse. So just know that most of these you can get a certification for. I did not become a certified pediatric nurse just because I was always in school. So I'm like, I don't feel like studying for another test. If I'm studying for a test for school and getting ready to study for the biggest test of my life, I don't regret it, but I really encourage you to go back for your nurse specialty certification, because one, you get paid more, and it just increases your knowledge for that specialty that you're working in, and you're doing a service to yourself and to your patients if you have that additional knowledge. There is hospice and palliative care nursing. Hospice and palliative care, as me and my friend Joanne was talking about, are two separate things, but almost one and the same. So hospice is end-of-life care. Palliative care is making the patient more comfortable with their chronic disease that they may have, which may not be, the chronic disease may not be life-threatening at this moment, but it's teaching them how to successfully live with this chronic pain or these chronic issues that they may have. Infection control nursing, once again, with the COVID-19 pandemic, infection control nurses are hats off to you. Infection control nurses, basically they help prevent infections in the facilities that, you know, we work in. You could just do medical surgical nursing, which is usually just a med surg nurse in an acute care hospital, working with adults, working with pediatrics. I was a pediatric med surg nurse. Nephrology nursing, basically a nurse who works with those who have kidney issues. As a nurse researcher, you can work in the lab, become a nurse manager. So after you've worked on the floor as a while for a nurse and you want to go into management, you can go into management eventually and run an entire nursing floor. My hat's off to those who want to do that. That is something that I never wanted to do, because you're in charge of schedules, you're in charge of all of the employees, making sure their educations are up to date, you're in charge of hiring. You run a whole nursing unit, and you're making sure it runs smoothly 24/7, 365. And oh my gosh, my hat was off to all my managers that I've worked with, because being a nurse manager is not easy. You can be an occupational health nurse. Occupational health nurse is a nurse that works at different facilities. I use the hospital as an example because that's where I worked the most as a nurse. And so occupational health nurses basically is in charge of all the employees and their health records, and if there were any injuries on the job, you would go see an occupational health nurse. Or like when I was out, when I had a surgery, I had to be cleared by our occupational health nurse. You can be an OR nurse, and that is an operating room nurse, and you are assisting the surgeons and the doctors and everyone else. I know you've watched Grey's Anatomy, some of you probably have, and so you can be an operating room nurse. Bulky. This whole time I thought was an instrument was a person. Not this whole time, but early on when I watched Grey's Anatomy, she is, you know, one of the longest running operating room nurses that somehow is in every surgery, no matter what specialty. But anyway, so yes, you can be an operating room nurse, and you can assist the surgeons, you can assist the doctors and the other nurses in the operating room with the procedures in the surgical setting. You can be an orthopedic nurse, and that goes without saying. Those who have musculoskeletal injuries and who need rehab and things like that. Pain management nurse. Pediatric endocrinology, once again dealing with patients who have endocrine diseases, and mainly diabetic ketoacidosis. Those who have hormone issues and things like that is what pediatric endocrinology nurses would do. You can work in the recovery room. So after the OR nurse has helped the surgeon successfully complete the procedure, then the patient comes out to you as a perioperative nurse or peri-anesthesia nurse, recovery room nurse, and basically you recover them for surgery, and you send them either home after you recover them, or you can send them to the medical surgical unit or medical surgical floor. So you know, a lot of these specialties interact. So I would see the recovery room nurse. She would bring, for instance, my appy. You guys know I have lots of appy patients when I worked in the hospital as a pediatric med-surg nurse, and so they would bring them to me after they recovered them. They usually recover them after they leave the OR for at least an hour or two, once the sedation has wore off, and then they either go home or come back to the floor to us, where we maintain their vitals and their hydration and making sure they're getting their pain medication and things like that. Being a lactation nurse, and a lactation nurse is a nurse who specifically deals with helping moms breastfeed. That's literally all she does. Is if you're lactating mothers, breastfeeding mothers, to help them successfully breastfeed their babies, if that's what you choose to do. Poison control nurse. You can be a psychology nurse or a psychiatric nurse. You can be a reproductive nurse and work in a reproductive endocrinology clinic to help women and men who have issues with reproductive, with fertility and conceiving. You can do that in an outpatient setting. School nursing. I thought about doing school nursing because it's right along with being a pediatric nurse, and you know, just dealing with kids who have chronic health needs. They come into your office a lot of times. They're, you know, of course you're there for emergency reasons, but you're also there for the kids who have to come take medications or need medications throughout the day. There's wound and ostomy nursing. I encountered that when I was in nursing school, and basically a wound ostomy nurse basically goes around and she cares for wounds. I mean, in ostomies. And an ostomy is an outer opening, a diversion from a specific part of your GI tract, either from your intestine. An ostomy is usually created from your GI tract if there's some type of obstruction, and basically we need to get the feces out, because you know, yeah. So wound ostomy nurses, they go around and they care for wounds, making sure they're clean and debrided and are packed the way they need to be packed, and there's not any infection in the wound. Same thing for the ostomies, making sure there's not any infection in ostomy, making sure they're nice, beefy red and healthy, and operating the way they're supposed to be operating, and basically keeping the patient healthy and infection free. And that is pretty much it. There is a wide array of nursing specialties that you can work in as a registered nurse. So someone asked me, do you have to do additional schooling in order to work in these types of specialties? No. Once you become a registered nurse, you can apply for any of these nursing jobs. The hard part about it is a lot of these jobs and these specialties want you to have experience. But, you know, there's some places that take chances on novice graduate nurses, and you're able to get in from, you know, right there from the beginning, working that specialty. It took me a minute to get a nurse as a job. To get a job as a nurse. And I think I mentioned that in why I became a pediatric nurse, or how I became a pediatric nurse. So like I said, I first started off as an outpatient OBGYN nurse. And while I did enjoy working outpatient, the way my mind worked was a registered nurse was supposed to work in a hospital. And so I wanted to gain acute care nursing skills before I went back to the outpatient setting. I wanted to learn how to do IVs, wounds, and surgical recovery and things like that. So I ended up getting a job as a pediatric nurse. And I probably would have loved being an L&D nurse too, because I worked in L&D my last year of nursing school, and that's what I thought I really wanted to do, is help deliver babies, which, oh my gosh, is an experience within itself. But I ended up becoming a pediatric nurse, loved it, and wouldn't change it for the world. So I did not have to have any additional schooling to do that. I just, you know, had to meet the right people, know the right people, and get into that specialty. And I said this in my how to get a job as a nurse. When you're out here in clinicals, making sure you're creating these relationships, creating these bonds with these nurses and possible nurse managers, so that if they need help, they, you know, if they're hiring, they know your face, they know your name, and you can give them a call. It's all about doing your due diligence, calling around and, you know, asking if they got your resume, asking if they got your application. You know, getting to just know people in these specialties if that's truly something you want to do. A lot of nursing students work as secretaries, work as nurse techs on these units, and then that's how they're able to easily transition into these jobs after they finish nursing school. So that is what I suggest to you. You don't have to do any additional schooling as far as the university, but there's always going to be continuing education credits that you're going to have to do your entire life in any type of job that you do, because that's just the responsible thing to do, especially in the healthcare field, because things change so fast. Protocols and procedures are always being created and always are changing, so you always want to make sure you're staying on top of your education. Even though now I'm done with school, I feel like I have a break in life, but I still am going to continue my education by going to conferences. I just ordered a suturing kit. I'm going to share that with you guys in one of my vlogs. You know, maintaining my skills that I've learned in school that I may not do every day because of the setting that I work in, that I may do in another office that I may work in, but I just may not do it this office. So it is very important that you stay on top of your education. And I say all that to say is, yes, you can get these jobs, but a lot of the times you should go further and get your certification, like I said several times through the video, so that you can have that advanced knowledge on how to care for your patients and your patient population. I hope this was a useful video. It's probably going to be short and sweet and to the point, because basically I'm just letting you know what's out there. Do your research of types of nurses that you can do, you know, once you become a registered nurse. And the sky is truly the limit. And I know it's going to be hard to get into these specialties. It can be hard to get into these specialties, but don't get discouraged. Don't let one negative Nancy, don't let 1, 2, 3, or even 10 no's discourage you from what you want to do, because believe me, in Janine's journey journey just throughout my entire life, it has not always been a bunch of ups, and I have had to pick myself up and say, okay girl, what's the next plan? So same for you. But as always, thank you guys for tuning in to Janine's Journey. I really hope you found this video informative. Make sure you give this video a thumbs up. If you have any questions or comments, please leave them down below. Make sure you subscribe and make sure you tell a friend. Woo! And I'll see you guys in the next one. Bye. Oh God. Past your NCLEX, neonatal, yeah, no. What do I want?